Hello everyone. So today we will talk about coronary artery disease. Let's start with the basics. So here's our heart. Our heart is basically a muscular pump that pumps out blood throughout the body. But the heart itself needs oxygen via blood to work efficiently. So this oxygen is provided by the coronary arteries to the heart muscles so that they can pump effectively. As you can see in the diagram, this is the right coronary artery and this is the left coronary artery. Now sometimes what happens that these coronary arteries, they become diseased or what we call as clogged. Now how does this happen? I'll explain you briefly. Now this is a coronary artery. There are red blood cells, white blood cells, cholesterol, everything is like flowing through in the blood. Sometimes due to some risk factors like high blood pressure or uncontrolled diabetes, the vessel wall gets damaged. This damaged vessel wall actually attracts the cholesterol. So the cholesterol starts depositing over this damaged vessel wall. This cholesterol deposit then attracts WBCs, white blood cells, and they also start depositing over it. And this starts a new inflammatory process which is called atherosclerosis. Atherosclerosis simply means hardening of the blood vessels. With time, as the cholesterol keeps depositing, it forms a fatty bulge, which we call as plaque. Now, when you have this big fatty bulge or plaque, the blood cannot pass through this efficiently. So as it keeps building up over time, then you will start to have problems. And we'll discuss the main ones here. Okay, so the first one is stable angina. What happens in stable angina that if a person is at rest or lying comfortably or walking at a normal speed, they will not feel anything because the blood somehow manages to pass through this plaque. But once a person puts the heart muscles to exertion, like exercise or running or dancing, then all of a sudden the blood will not be able to pass through that quick. And that particular muscle will then not receive oxygen and it will become hypoxic. So they will start developing symptoms called angina pectoris. What does angina pectoris mean? Angina is a Greek word which means to strangle, and pectoris means chest. It is termed so because the patients, they will describe that they have a feeling of tight and strangling pain in the chest. This is stable angina, briefly. Why is it called stable angina? Because it is reproducible. Like if you will decrease the activity and the heart will have to work less, so the blood and the oxygen is enough to pass through the plaque to supply the heart muscle again. So the symptoms of angina pectoris will go away. But once you start exerting yourself, the symptoms develop again. When things get worse than stable angina, it refers to acute coronary syndrome, which is further divided into unstable angina and myocardial infarction, also called heart attack. Now let's go back to the plaque to understand what unstable angina is. Sometimes due to hypertension or some other risk factors, this plaque ruptures. Basically, it's covering bursts and it exposes its fatty material. This fatty material is very thrombogenic. Thrombogenic basically means that it attracts the blood and clotting materials. These will come and attach to the plug. So now this becomes a blood clot. Now this blood clot actually flaps in the artery from side to side. So sometimes it can block the artery completely and sometimes not. So the patient will complain of chest pain even at rest now, because this blood clot can flap any time of the day. This blood clot which is formed can either completely block the artery, which is called a thrombus, or it can break off a smaller part of it, which is called an embolus, and this embolus can flow through and block a smaller artery. When either of this happens, whether it is thrombosis or an embolism, the blood supply is completely cut off to a particular part of the heart. So now that particular part of the heart will permanently die due to hypoxia. And this is called a heart attack or myocardial infarction. So this was a basic introduction of coronary artery disease. In the coming lectures, we'll discuss in detail the management of acute coronary syndrome. Take care. God bless you all.